We'll call the Kansas County Board of Commissioners meeting to order. Let's stand for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning and welcome, everybody. We have a fairly full agenda today, but they're not hard decisions to make because a lot of it is recognizing the work that our staff does throughout the year. But before we get to that fun stuff, we have on our agenda, you received a packet in the board, and I'd look for a motion to approve the agenda as presented. Hang on one second. There was one addition at the very end, presentation or introduction to Emergency Operations Director Otis King. So with that addition, I'd look for approval of the agenda.
So moved, Mr. Chair.
Commissioner Gardner moves on the agenda. Do I hear a second?
I'll second it.
Commissioner Dwayne Anderson moves, seconds. Any discussion? All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. You also received the consent agenda. And in the consent agenda, we have the approval of the April 16th minutes. We have the approval of the auditor's warrants and claims, and then we have the Federal Boating Safety Patrol grant agreement, which is a renewal of a standard grant that we get from the DNR. So I'd entertain a motion to approve the consent agenda.
Mr. Chair, I'll move.
Commissioner Dale Anderson moves on the consent agenda. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. All right, so first up on the general business discussion and updates is Woodland Center's update. Dr. Chose. Welcome.
Morning.
For the record, everybody who goes to the podium, if you'd state your name and who you represent.
For sure. I'm Ashley Chose. I am the executive director at Woodlands Centers. Woodlands is the mental health and substance use provider in Kansas County, but we also serve 7 counties primarily throughout the area. So I like to come every year and just give you all an update, answer any questions you have. I believe you got the information, hopefully. Yes. Okay. So I'd like to talk about just 2023, some of the data that we have regarding our client care, who we served, and then, like I said, any questions you all have. So last year we served 5,324 individuals. It was 576 more than the previous year. So we're seeing more and more people come through our doors, which is great, and we're able to serve them. The pie graph that you see there is the breakdown of clients that were from our 7-county region. So of the 5,324 we served, 84% were from our 7-county area, and 45% were from Kansas County. So we just like to break it down there so you can kind of see the percentages based on the counties. The graph below that shows all the ages that we served. So the majority of folks you can see there, are from that, we serve a lot of 13 to 17-year-olds, about 16% there, but then a lot of folks between that 25 to 54 age range are the majority of folks that we see. Last year, our youngest served was 2, our oldest served was 89. So we do serve that entire age range of people walking in our door. Or being carried in our door, probably the case of the 2-year-old. So total for youth between 0 to 17 was 32% of our clients. Older adults, 65 plus, was about 6%. So we are seeing more elderly coming through our doors as well and needing more care. So we anticipate that continuing to increase over time. I also included here race and ethnicity of clients served. This is another area where we're hoping to have a bigger impact. We know we serve a diverse community, especially here in Kansas County, and so how can we have an impact on the number of clients that we're seeing from some of those diverse communities? So when we look at the Hispanic Latino community, about 16% of our clients identify as Hispanic Latino. And we have about 3% that identify as Black or African American. So again, we're hoping to serve more of the clients from diverse communities, so just trying to track this over time to see where those changes come. I also included employment status of clients served, just so you can kind of see the different statuses that we have. A lot of folks are, either employed, about 28%, and then we have that unemployed, which is about 20%. And then we have our youth there that are the large pie, which is about 31% that are our youth that are just not in the workforce as of yet. So just wanted to show you the range of folks that we're serving. Any questions on those first couple ones just about our population that we're serving?
Any questions for the board? I do have a question. You meant, excuse me, you mentioned more elderly are being served, probably more in general. I think I saw that number
Correct,
too.
yes.
Is there a correlation between it being the cause and effect? I mean, is it more stress or is it more awareness? I mean, we spend a lot of effort trying to take the stigma away from talking about mental health issues. And so is there any measurement of either one of those as it relates to the numbers?
I'm not certain which one it is. I will tell you all of our advertising, our marketing is not, come see Woodland Centers, we're the best. I mean, we think we're the best, but that's our marketing, right? It is about get your service, get care. Here's what mental health is. Here's why it's important. So it is about reducing that stigma and increasing awareness. And we're everywhere. You can't really go anywhere without hearing a Woodland Centers ad or seeing our face somewhere. And that's our goal, is so that you might not need it today, but when you need it, you know that number, or you know that jingle, or I can get a hold of Woodland Centers. And so I think it's a little bit of both. I think the stigma has reduced a little bit, and I think that people are just more aware that there's an issue, and the stress level is still really high. I mean, we're probably out of the COVID stress, but there's just other stressors, right? It's, the cost of living is higher than ever before. People are wanting to retire, but uncertain how to do that. So when you talk about baby boomers, people like that, it's figuring out all those pieces, and it's hard. It's hard for people. Yeah. So
Thank
things
you.
are-
Thank you.
Yeah, for sure. I included the modality of services over time just so you can see how things have shifted. 2020 was the year of COVID, and so everything really changed for us during that year. But over time, you can see we are moving back to more in-person services. So in 2023, when you look at our whole agency, 78% of direct care services were provided in person, with 20% being telemed. The graph below that I wanted to include because we do have some services that differ from that average. So if you look at adult day treatment, for example, 97% of services are still happening via telemed. And that a big part of that is because people can access those services. It's a group therapy service, a group skills and therapy component. And historically, it was all in person in Wilmer. And so if you were going to get that service 3 hours at a time, you had to drive here. Well, now we have the service accessible to anybody in any community just sitting down into your home. And we now have, I believe, 5 groups running, and we are full. And it's been a significant increase in our day treatment productivity. So we just are adding more groups all the time. So we feel like this modality is working for people, and we're getting more care to folks. The other 2 big ones are therapy and medication management. Again, outside the norm, about 65% of therapy is happening via telemed, and then 66% of medication management with our psychiatry folks. Some of this is just client preference. Some of this is because our staff members don't even live in this state. They're contracted telehealth providers, and so all of what they do is telehealth. And so sometimes these appointments are via telehealth, but they're coming into our clinic to actually do the service because they don't have access to a device. We set them up, but it's still counted in that telehealth because our provider's offsite. So there's a lot of different ways we're providing care, but I wanted to provide you all just an overview of kind of what we're seeing in some of the trends. Any questions on that? Okay. All right, mobile crisis. I like to include this as well, just to show you over the last year compared to previous years, how our services continue to grow in this area. So again, as a reminder, the assessments piece, this is when we first go out to see somebody. They call our mobile team. They say, hey, I just need to talk to somebody. Our team goes out and we do an assessment on site. So last year we did 570 assessments, which was more than 2021 and 2022. And then stabilization services, these are what happen after the assessment. So between the time that we assess the crisis need and before they get in for services, we can continue to provide individual services to that family or that individual. And we do that for a few weeks, days, whatever it is for that person. And we call that stabilization. So last year we did 1,584 of those services, significantly more than the year before. That just continues to grow and grow. It's a really great service. So last year we did 2,154 mobile crisis services across our 7-county region. It's just growing every day.
Could I-
And we did add we add our urgent care program.
Commissioner
Yes.
Duane.
So I was just wondering, the stabilization, is that medication or is it just counseling or is it a combination or?
It is not medication, it is typically skills-based. So we'll go out for a crisis call and maybe it's, I'm anxious, or, Johnny won't go to school today, whatever it is. And then we'll follow up on that. How's it going? How's it going getting Johnny out of bed in the morning? Any other crisis stuff that you're dealing with? And it's really skills-based of how can we help you with your anxiety today? How's your suicidal thoughts? How are your skills working through that? Safety planning, risk assessment, that's really what goes into that.
So not medication?
Not medication.
Okay.
No. We do have a couple appointments per month that are reserved for our mobile crisis team with our psychiatric providers. We call it rapid access. So if somebody is needing that access really quickly, we can get them in through those slots.
Okay. All right, thank you.
Yes. The next graph here, that pie graph, is about our 24/7 crisis line. So Woodland Centers manages the crisis line for our 7-county region. And this is the calls that we get through that crisis line for the last 3 years. So it was 5,248 total calls. Of those, you can kind of see the breakdown here. Most of them, we obtained crisis information. So 33% of the time we get crisis information, but no further action is needed. So somebody might call us and just say, I'm kind of struggling today. I don't want you to do anything about it. I don't want to see your team. I don't want to come in. I just want somebody to know I'm struggling today. And so we'll take that information and we do a crisis assessment. If somebody is at risk for suicide, we take action and we let them know that we're gonna do something with this. But 33% of the time we might just take that information, follow up with them the next day. How are you doing today? 28% of the time we have an immediate mobile dispatch. So they call in and our team goes out. Sometimes I'm trying to see where the number is. The mobile crisis dispatch within 24 hours, it's 3%. Somebody might call us and say, I'm having a hard time, but I'm at work. Can you come to my house at 6? And we'll do that as long as there's not a safety concern. So we might schedule to go out and see somebody. So that's where that little 3% kind of comes in. And then other times, so that 33% call for another resource. People might call into us, but actually they need our residential crisis line. They need a detox facility. So we are doing those warm handoffs to other treatment facilities if that's needed. So just to give you an overview of kind of all the different types of calls that we're fielding on that crisis line.
And, excuse me, what is the training of the people taking these calls?
Yeah, that's a great question. So we have what we call mental health practitioners answering these phones. So typically they have to have some experience working in the mental health field. And then we provide them at least 30 hours of training before they start. And then we're doing ongoing training with, what types of calls might you receive? How do you manage just hearing all of these calls? Because that can be challenging too. So it's an ongoing training process, but we do some pretty intensive upfront training just on co-occurring disorders, the process to handle the calls, who you're talking to. We have one person taking all the calls on any given day. So there's not a group of people, it's one person. And then they have a therapist that they can call. So if there is a situation and they're like, I'm not sure what to do, there's always a clinician they can call and talk to if there's a clinical situation. And then also their supervisor. So they have multiple kind of aspects to run to.
Thank you.
The next data there is our residential admissions, just to show you over time how those numbers have changed. I will say detox looks not great, but we did close our detox unit in November, so that number is going to be low because there's 2 months of data missing there from 22 to 23. But as you can see for adult crisis and youth crisis, our numbers went up by 6% and 8% respectively over the year. So we're continuing to see more admissions into those units. We have started our remodel. So since we closed detox, we have looked at making the transition to expand our youth and our adult crisis units. So adult crisis is going to shift over to where detox was, and we'll actually be adding 3 additional beds. So we'll have 8 beds total. And then youth crisis will stay where it is, but we're going to add 1 bed. So we'll have 6 beds over there. So we're hoping, and I cross my fingers, that the remodel will be done by this fall so we can open that unit, those units up for those extended beds. because we are at this point having to turn some folks away because we're full. So that's the hope for this year.
And where are the detox folks going to right now? If folks in need of detox services?
Yeah, so Project Turnabout is probably the closest detox facility. St. Cloud also has a facility, and then Brown County. Those are probably the three closest. And I think most folks were kind of headed in those directions anyway, unless they're needing medical care. What we were seeing is so many people were at that point where they needed medical care that they ended up at the ER because they were at that high risk level. And then by the time that they were below that risk level, they were discharging home. So they weren't really using our detox the way we had historically used it.
Okay, thank
I
you.
have been checking in with law enforcement, with social services, just say, are you having trouble? Are you seeing folks that maybe we haven't been able to get to a detox center? And I have not heard a lot of rumblings of like, oh man, we have such a loss. And so for me, that says, we're able to get these people's needs met. And we're not seeing a lot of people going without care so far. So I'll keep checking on that and seeing if there's any gaps that we're finding. So, yeah. I did put in here purchase of service biannual data as well. So this is on our contract, just so you all can kind of see some of the pieces that we're monitoring for our purchase of service contract. One of the pieces is 85% of clients seeking services can gain access within 10 days or less from their first contact. And so from January 1 to June 30th, we hit that at 81% of the time. And then July 1, again, it was 81%. So we did not meet our mark of 85% there. We're still looking at what can we do to improve this. Some of this is we have same day access. Sometimes people call and say, well, I don't want to be seen today, but the clock starts. So if we don't get them in within 10 days, our clock is still running. So we're just trying to figure out how we can improve that number. So still looking at quality improvement for that piece. The next two measures are really screening clients. The first one is about social determinants of health or social needs of health. We know that we could throw depression care at people all day long, but if they don't have a safe place to live or if they don't have food, they're not going to get well. So we're screening everybody. Our goal is to screen everybody for social determinants of health and help them find access to those resources. And so our goal last year, because we just started it, was to ensure at least 50% of people, and you can see by the end of the year, we were at 86% of clients that had that screening tool. And then the second screening tool is the Columbia Suicide Risk Severity Scale. And this is a short screener just to quickly assess somebody's risk for suicide. And our goal there was at least 50%, and we were at 87 by the end of the year. I did also include a waiting list. This is from February, so it's old, so I wanted to update it a little bit. Just to give you a couple different numbers. So right now, ACT, we actually do not have a waiting list for ACT any longer. We're accepting referrals. Outpatient depression management, that one is still 5 on the waiting list. Outpatient therapy, we're actually down, so we're at 151 on the waiting list right now. So we're down 20, so we got a few folks in. Adult rehab services is actually up. We're up 46. So we had a couple people go out on medical leave. I think we've had somebody quit. So we're in the process of trying to backfill behind for armed services. Psychiatry, we have 6 total right now of referrals, and they were all added in April. So as soon as somebody gets on the wait list, typically the next month we're getting them off the wait list. So that wait list is flowing pretty smoothly. And then the other ones are pretty consistent with what is on your list. So I just wanted to give you a couple updates. There are a few that have shifted up, a few that have shifted down since February. Do you all have any questions for me?
Commissioner Gardner.
Thank you, Mr. Chair. Dr. Chose, thank you, first of all, for being here, and I have the privilege of serving on the board for Woodland Centers as well. When we're talking about these wait lists, is this just kind of the norm, or have we seen an increase in people having to wait for services, especially since the pandemic?
Yes, unfortunately, yes, across the state, we're seeing this. Every mental health center, every agency that provides mental health care, we're seeing these wait lists. Part of it is people are accessing more care, which is fantastic. We want people accessing care, and we just don't have enough providers to provide the care. And so all of us as providers are trying to figure out how do we manage that and how do we help fill some of those gaps. And it might mean for us what we've really focused on is getting people in our door, because although we have a wait list for therapy, they might also need adult day treatment. They might also need psychiatry. And so if we can get them started in those services, at least they're getting some care. And then what we also do is we refer out. So if somebody says, I need therapy, here's all of the area providers. We're not going to, hold on to that person hoping that they come to us, knowing that we have a wait list. So we can help them get access to other providers too, if perhaps they don't have a wait list. But it's across the board. I think we're all trying to figure out the workforce challenges, and with licensed providers, it is feast or famine. It has been really tough to get providers. Thank you for that question.
And thank you. And would you just be able to very briefly, because I don't want to forget this, we've talked about this at board, but Woodland Centers is not a joint powers, but rather it's a nonprofit. Can you kind of explain the structure of that for everybody who's watching today?
Yes, absolutely.
Everybody here up front as well.
Yes, absolutely. So Woodland Centers has always been a private nonprofit entity. I think our board and sometimes our field has felt like a joint powers. And I think over time we've had to look at that and figure out what is the difference and how does that work? Because we've had commissioners on our board. And I think looking back historically, that's how most mental health centers in the state of Minnesota were started. Even though they were private nonprofit agencies, they were started as a joint kind of coming together of counties. So not a joint powers, but a coming together to agree that we should all have these mental health centers, and they formed it under a private nonprofit. And so how that shifts, I think, for the gentlemen that are on our board, is that information shared at our board is private. It is not open for public discussion because we're a private nonprofit. And so it's a shift. And I think we've done a lot of education. Honestly, I've done a lot of educating myself of like, okay, what does this really mean? And then trying to share that with the board of how does this work and what does it mean to be on a private nonprofit board? And it is different than a joint powers. Yeah. I don't know if you want me to say more. I can.
No, that's perfectly fine. Thank you.
Yes, yeah.
Mr. Chair. Thank you, Mr. Chair. I just really more of a comment than a question, but the collaboration with the Woodland Centers over the years has been pretty fantastic. And as everybody probably are well aware, the county board is the mental health authority for the area. So we're responsible for this. And we have our staff, we have excellent staff that really work in that area. But the capabilities of providing all these services is beyond our scope. And the collaborative nature with the Woodland Centers, we are so fortunate to having those services here. And I think you just kind of brushed over all the different kinds of services you're really providing, and where you have staff working with other agencies, Prairie Lakes Youth Program and so forth. And, we're very fortunate to have it in our community right here. And I picture Candioi County in our area, our region, is a healthcare center. And mental health is part of healthcare, and it's a big deal. And as you can see, a number of people being served. We're very fortunate to have these kind of services here. But you think, at first when I got on the board, that all these services, my gosh, we never had these kind of services. But you look, we have so many needs out there. We're still scratching the surface to meet all the needs in our community, and struggling to move forward. But I commend you and your agency and your staff on the collaboration, working with everybody and the whole region, 18 counties and more. And that's the first time I think I saw that you served 67 counties. So people do end up here for services in different ways. It's good for our community that we can be a mental health service area.
Agreed.
So thank you.
Yes. Yeah, the partnerships are very important to us, and I think that's been a big focus for us. We can't do this alone. We're not going to be the be-all for everybody, and so how do we partner with family services? How do we partner with law enforcement? How do we partner with the jail? Just all of our community partners. It's so important because we all have a piece in this, and again, we can't do it alone. And so those partnerships are just vital. And that might be the one person they trust is, their social service social worker. And so if that's the person to get them in the door for mental health services, that's the person. And so it's those collaborations and those partnerships that help bridge those gaps to get people the things that they need. And it's just vital.
What, Mr. Chair, one more question.
Go ahead.
Would you share how many staff are employed right now?
Yeah, so we have about 250 staff at Woodland Centers across our 7-county region. Just to give you an idea of our growth, it's been a lot. In 2022, when we started CCBHC, we were at, I want to say about 200. About a year before that, we were at about 180. So in 3 years, we have grown substantially by about 70 staff, and we're continuing to grow. There's new standards out there for CCBHC, and so we're going to be adding a lot more medical monitoring and just doing more referrals to medical, because we know people with mental health conditions tend to not manage their medical care well, and we might be the only source that they're seeing for their whole health care. And so how do we get them in for those services? And so we're going to be doing more of that, so there'll be more staff. Yes.
Well,
Yeah.
Mr. Chair, may I follow up? Yeah, thank you. And I'm assuming too, along with all these extra responsibilities comes the extra responsibilities of documentation and all the rules and regulations that you got to cross the Ts and dot the Is of make sure that everybody's safe and doing things correctly.
100%.
And all the training involved and
Yes.
ongoing training,
Yes.
licensings and credentialing.
All of it. Yeah, there's a lot to it, and we're adding some more technology components to really help us with some of these pieces. So one of them is Mira. It's a measurement-based care platform that helps us to automate some of the measurements we're sending to clients, because we do a lot of screening, and we're really trying to use those screenings in a clinical way to determine what does this measurement mean about the care we're providing, or maybe the lack of care we're providing, and how can this inform our treatment plan. And then we're also implementing Elios, which is a AI tool to help us with our note writing. So that way we can save some of our staff time, because we know every note, like therapy note, takes at least 15 minutes to write. So if we can save that time, what more can we provide to our clients? So those are some things we're hoping to do to just help with the care and help improve the care we're providing. Yes.
Thank you.
Yes, thank you so much for your support and everything you do for us.
Thanks for coming in and staying right on schedule for us.
Thank you. All right.
Next up, is kind of a tag to what we just heard, is Corinne Torkelson and Gossett Nelson, talking about social services from our perspective, or from our department.
Yes, and I am going to start, and before I read the proclamation, I was just going to give a highlight of on one of the things that we're working on.
For those that are listening,
Corinne Torkelson, I am a supervisor with Candido County Health and Human Services.
thank you.
And which this is tying right into what Ashley and Commissioner Berg were saying about the partnership. And when you guys had your work session in March, and I really talked a lot about the challenges and the difficulties and the acuity that we're seeing in mental health. And so today what I wanted to be able to do is just take a couple minutes to be able to highlight some of the work that our agencies and departments have been doing together. A while back, I don't know, 5-6 months, a while back, Ashley and Jessica Delzer from Center Care from the Mental Health Unit and myself met. And one of the reasons for that meeting was to be able to talk about what are we seeing as those challenges, being able to address what we're mad at each other about, if that makes sense. And so out of that, what we created was at an administrative level, we brought together law enforcement, Woodland Centers, Center Care, Corrections, the County Attorney's Office, Human Services, to, like I say, at the administrative level, to be able to start to say, what are you seeing as challenges? What's working for you? What's the good and the bad that's happening? And that's been real helpful. We're calling that our mental health partnership group, to be able to realize the challenges that are increasing. I think, like we had talked about at the board on the work session in March, is that the acuity that we're seeing within the community of consumers is increasing. And with that, obviously, comes many more challenges for each of our areas. So we're continuing to have that administrative partnership on meeting, but one of the things that came out of that is we have developed what we're calling a consultation team, and that is people from each of those areas that are each of the agencies and departments that I just talked about, but it's more staff. The staff are dealing with those challenges every day. And some of what we're looking at is to be able to talk about law enforcement being frustrated that they take someone to ER and then they're out in a matter of hours, or on corrections being frustrated that their client isn't going to be committed, those sort of things, and really looking at what is the work that we're each doing, how are we doing that partnership together, and what is the reality of what each of our areas are able to do, and really wanting to do some education about that, because it's really easy to feel frustrated, like, well, why aren't they doing this? Or, oh, that was really good. What can we do to build on to something like that? So that I just wanted to be able to highlight that work that we're doing as it relates to mental health, and I just think that partnership hopefully is going to be able to keep moving us forward. Okay, questions on that at all? All right, then I will read our proclamation. On Mental Health Month 2024, whereas mental health is essential to everyone's overall health and well-being, and whereas all people experience times of difficulty and stress in their lives, and whereas prevention is an effective way to reduce the burden of mental health conditions, and whereas there is strong research that companionship, humor, spirituality, religion, recreation, social connections, and work-life balance can help people protect their health and well-being. And whereas mental health conditions are real and prevalent in our nation, and whereas with effective treatment, those individuals with mental health and other chronic health conditions can recover and lead full productive lives. And whereas each business, school, government agency, healthcare provider, organization, and citizens share the burden of mental health problems and has a responsibility to promote mental health wellness and support prevention efforts. Now, therefore, the Candido County Board does hereby proclaim May 2024 as Mental Health Month in Candido County. As the board chair, I call upon the citizens, government agencies, public and private institutions, business and schools in Candido County to recommit our community to increasing awareness and understanding of mental health, the steps our citizens can take to protect their mental health, and the need for appropriate and accessible services to all people with mental health conditions. Signed the 7th day of May, Roger Dempsey. Sorry, I always say the wrong, Chair of the Board of Commissioners. That's the proclamation.
And do you want to, accept the motion to accept this proclamation?
Mr. Chair, I so move that we accept the proclamation for Mental Health Month 2024, effective this date.
I'd entertain a motion for a second.
Second.
Commissioner Gardner seconds. Commissioner Berg made the motion. Any comments or questions? All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Do you want to go right into the children's or?
I am going to turn that over to Constance now.
Very good. Thank you. Is that it?
Good morning. I am Constance Nelson. I am a Children's Services Supervisor for our agency here. My new team configuration is comprised of children's mental health case managers, family child care, and child foster care licensing, truancy, and adoption. And I have almost my entire team with me here today. I just wanted to spin off a little bit on this idea of collaboration for many proclamations this morning to be read. Collaboration really is key. Dr. Chose and Corinne have already touched on that, and I really want to highlight a piece of collaboration and how children's mental health gets some services, connects families and children to those services. Our agency's children's mental health team is very proficient in this way. Collectively, they have over 150 years' experience serving the unique needs of their clients through creative problem solving and partnership with numerous agencies. within our county, within our state, and even beyond. 4 of these workers do ongoing, more long-term case management. I'll read a couple names if you want to just give a little wave. Tammy, Rain, Gwen, and Noelle. April is the proverbial linchpin of our team, supporting us with decades of mental health experience. A 5th worker, Malia, is often the first point of contact here at the agency. She and the family will sort out what the family hopes to accomplish with help from our team. Sometimes this means that she assists them to connect with other resources within the agency and or the community, and sometimes this means that she learns the family was referred for services by another agency, but maybe doesn't want them or isn't quite ready to receive them. Because children's mental health is a voluntary service, we then are unable to proceed with those families, but she does her best to ensure the families are making an informed decision either way. If the family does wish to proceed, Malia will assist them in determining eligibility if they haven't already acquired this information. To be eligible for children's mental health case management, the child or youth must possess an SED statement or severe emotional disturbance determination from a mental health professional. Many of these determinations are made through a mental health center such as Woodland Centers. In 2023, Malia assisted around 100 families, half of whom proceeded with case management. Of the other half, only 4 were determined to be ineligible for children's mental health services. Overall, our children's mental health case management numbers have hung pretty consistent to recent years, but we were fortunate to see lower case management numbers where we're actually down from about 70 children's mental health cases in 2021 to around 50 both last year and in 2022. Interestingly, despite our caseload numbers going down slightly, I believe we continue to see startling high acuity with all of our cases. So by all means, they do not feel like they are serving fewer families because the needs are far greater. Youth who are experiencing the most significant mental health symptoms sometimes require placement or hospitalization, and in order to find adequate levels of care without months-long wait lists, sometimes case managers need to consider settings hours away. We've had case managers traveling to Duluth, Iowa, the Metro, even Grand Rapids and South Dakota. So many, many hours on the road that these workers spend to serve these kiddos. Where's the good news in all this? It's right here. It's our staff. Our staff show up and bring their best selves forward every day. They are committed to being trauma-informed and meeting our kids exactly where they're at, and that is a moving target. They advocate, they share tough messages, and they persevere no matter what situations they encounter. In order to honor the youth they serve and to provide support and encouragement to anyone that might need it, as you can see, staff have come matching this morning. And so I'm wondering if I can allow one of our staff, Tammy, to share just a brief memo about the shirts that we are wearing, and then I'll proceed with the Children's Mental Health Proclamation.
By all means.
Thank you.
Good morning. My name is Tammy Thompson. I have worked for Candiota County for 23 years, majority of that time in children's mental health case management, which I'm very passionate about. The sad t-shirts, I'll at some point have everybody turn around. So if my crew wants to, Constance's crew wants to turn around, they'll have different messages on the back. I'm happy you're here, stay another day, and different things like that. We were able to get matching t-shirts after I was in Rochester visiting one of my youth that's in placement down there. And I went to his school, and the school nurse was wearing a t-shirt that said SAD on the front. And I was like, wow, I really like that t-shirt. You know, where did you get it? She informed me that her daughter, who struggles with mental health issues, specifically has made attempts, suicide attempts, had therapy that day and said, Mom, I have therapy today. Can we wear our matching shirts so that I can feel that power and know that we're together in this. So that's how the t-shirts came about. I love the message for something that is so complex as suicide. Sometimes just a simple message, stay another day, I'm here for you, can mean the world. We often ask people, how are you doing today? I think we have to be prepared for the day that someone says not good. Today, I am not doing well, and be there for them. And that's what these ladies and we try to do every day, is to come and be present for our community, the children and the families that we work with. So thank you for the proclamation, and I hope all of you a great day.
Thank you.
Thank you.
I think that's a great opportunity to segue right into the proclamation, where we would specifically be honoring children's mental health specifically. Whereas addressing the complex mental health needs of children, youth, and families today is fundamental to the future of Kandiyohi County. Whereas the need for comprehensive, coordinated mental health services for children, youth, young adults, and families place upon our community a critical responsibility. Whereas it is appropriate that a day should be set apart each year for the direction of our thoughts toward our children's mental health and well-being. Whereas each child, youth, and young adult with mental health or substance use disorders requires a unique approach, a collaborative framework has proven effective in addressing the mental health needs of these individuals and their families within our community. Now, therefore, the Kandiyohi County Board does hereby proclaim May 9th, 2024 to be Kandiyohi County Children's Mental Health Awareness Day, and urge our citizens and all agencies and organizations interested in meeting every child's mental health needs to unite on that day in the observance of such as will acquaint the people of Kandiyohi County with the fundamental necessity of a year-round program for children, youth, and young adults with mental health or substance use disorders and their families.
Thank you. And I'd entertain a motion for acceptance of this proclamation.
Mr. Chair, I'd like to make a motion that we proclaim May 9th, 2024 to be Kandiyohi County Children's Mental Health Awareness Day.
Commissioner Dwayne Anderson moves on the proclamation. Do I hear a second?
I'll second it.
Commissioner Dale Anderson seconds. All in favor, signify.
Wait.
Whoop. Go ahead.
If I may. Thank you, Mr. Chair. I want to say thank you for everything that you do on behalf of our kids. This is personal for me. In the early to mid 1970s, we did not have access to services like this. And growing up in a trauma-filled home, it was incredibly difficult, and it impacted me on through my early adult years as well. Everything worked out somehow because I was able to finally receive services as that young adult. But doing this for the kids and doing this for our community, I cannot imagine what you're going through. I hope that we're taking care of the caregivers as well. So thank you for what you do on behalf of the kids and on behalf of those who wished they had had services available to them so many years ago. Thank you.
Thank you. Dale, Commissioner Dale Anderson.
The one thing that just popped in my mind, and I think it's really something that we need to consider and think about, and I think this is a great way to keep it in our head, is exactly what you said about we have to be ready for the day when we ask somebody how they're doing and they say not good today. Because I think I've got grandkids and the world's changed, and I oftentimes wonder if I'm going to freak out when they say it's not good today. And I think we have to think about a way to say, hey, tell me about it, or explain to me, or let's see who we can talk to. And I think that's the biggest thing about having this data, to keep it in the back of our head so that we don't freak out and not have the right answer. So I think that's an important thing it's going to happen to a lot of us. We're going to get that answer that, not real good today, or this is really, really a tough day for things that are going on in school, or or things aren't real good at somebody's house. I mean, I think the world's changed a lot, and that's important. I think that we have that ability to answer that kid's question when they come to us.
Any other comments or questions?
Mr. Chair, yes, I'd like to make a comment before we vote on this. First off, this is a proclamation for Awareness Day, and the previous one was for adults and mental health altogether for the month. I think as a board, it's pretty obvious that we feel you provide those services and live this out with the people you're helping year-round. And again, thank you for everything that you do in those areas, but I appreciate it very much.
Thank you. You know, I did have a question. As you were talking about the collaboration and pointing out the importance of it, what role are the schools in the area playing in that collaboration and helping bring awareness and attention and maybe identifying where some of those needs should be directed?
A lot of our schools will make referrals for children's mental health, and whether or not they are making the referral or already involved with case management, our case managers are in very frequent communication with all of the professionals and informal supports around a child and their family. And so our staff will attend individualized education plan meetings with the schools. They'll have frequent phone conversations with special ed teachers and paras, really trying to get an idea of how the child is doing in multiple different settings. And of course, if we notice that there are behaviors or struggles that present, say, at home, but not at school or vice versa, then we can kind of get some clues on how to serve that child differently.
Yeah, thank you, because they're often the first line of defense after the family of knowing, not defense, I should say awareness
Absolutely.
of what's going on, might be going on in a kid's life. So what everybody else said regarding our appreciation, I want to add to that, our thanks on behalf of myself and everybody else here. So all in favor of the proclamation, signify by saying aye.
Aye.
Opposed, same sign. Motion carries. You have one more, I think you're up next, if you just want to stay up. And then we'll take a short break.
I have two quick areas that I'd like to discuss. I did just bring all of the proclamations for children's mental health, and the next two I'd like to talk about. May also has Child Care Provider Day, which is held annually the Friday preceding Mother's Day. I plan to present more thoroughly on family child care at the next board meeting, but I did want to have an opportunity for the proclamation to be heard before the actual Child Care Provider Appreciation Day this Friday. If I may, I will move into reading that. And then while I read that, I just want to honor that we have two important staff here in the audience regarding child care. One is our staff person, Tammy DeVos, our family child care licenser. And next to her is Tana Stuckey. She is the Wayfinder person that is employed through UCAP. She and Tammy do a lot of collaboration together for the licensing process and making sure that family child care providers have the resources, supports, and information that they need as well. Child Care Provider Appreciation Day, May 10th, 2024. Whereas our future depends on the quality of the early childhood experiences provided to young children today, and high-quality early childhood services represent a valuable commitment to our children's future. And whereas Candy Ojai County child care providers are serving children so family members may accept or maintain employment. Whereas the contribution of child care providers to our children's future is worthy of the highest respect, and whereas by calling attention to the importance of high-quality child care services for all children and families in Candy Ojai County, we hope to improve the availability of such services. And whereas Candy Ojai County encourages parents to take May 10th, 2024, to show their child care providers how much they appreciate them. Now, therefore, the Candy Ojai County Board of Commissioners do hereby proclaim May 10th, 2024 as Child Care Appreciation Day and urge all citizens to join in acknowledging Candy Ojai County's child care providers for their invaluable contributions made to the children and families of Candy Ojai County.
Thank you. I'd entertain a motion to accept this proclamation.
So moved, Mr. Chair.
Mr. Gardner moves. Do I hear a second?
I'll second it.
Commissioner Dale Anderson seconds. Any comments or questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you.
And finally, May is Foster Parent Appreciation Month. In the spirit of honoring our families, I've brought our licensor for child foster care, Leanne Kitzman, with, as well as our adoption worker, Tina Magus. I've got Leanne over here, Tina over here. And while Tina is not the licensing worker, she and Leanne kind of act like bookends on a placement case, which I can touch on later if we have time. I recall a few questions during one of the board meetings last month about supports and numbers regarding relative foster care. I started keeping an eye on these numbers in 2019, given I was in the licensing role at that time. Since then and presently, we remain hovering right around 60%, where our children are placed with relatives with whom they're familiar, they're already connected. Relatives and non-relative homes, however, must go through the exact same licensing process, with one key difference. Relatives are able to start caring for children before they hold the foster care license, but are required to actively work on that licensing process, and that is one that they did not necessarily sign up for. They did not come to our agency requesting to be licensed most of the time. They were thrust into that situation. And so part of our licensing role, as well as our child protection and children's mental health case management roles, is to really wrap around these families and support them the best we can. I think it could be of interest, perhaps to you and maybe the public, that there are kind of two paths traveled during foster care placement. One is the licensing process, and the other being that case management piece that I just talked about. The picture a Venn diagram. We've got licensing in one circle, we've got case management in the other circle, and then where those two circles collide, there's a lot of overlap in that support. Licensing is really going to connect families to getting their background checks completed, making sure applications are processed, training is acquired, making sure that the home is safe and that all of the individuals in that home are safe for the children to be around it. And then on the other side, case management is really going to be focusing more on the child and the parents. They're going to be doing the concurrent permanency planning, working on reunification efforts to try and get those kids home so that they don't have to remain in foster care. And then, of course, if that is unsuccessful, that's where our permanency specialist, Tina, would come into play kind of at the end of a case and help those relative caregivers become eligible to care for those children forever. So given that our foster parents are wearing many hats every day, they didn't necessarily sign up for all that they are thrust into. We do try to honor them on an annual basis. And so this year I wanted to invite our licensor, Leanne Kitzman, forward to just give a small update on what our plan is this year.
Good morning, everyone.
Good morning.
I'm Leanne Kitzman, as Constance had mentioned, and I am the new foster care licensor, child foster care licensor. So every May, for as long as I've been here, we have honored our foster parents every May or around this time of year. We've done a variety of different events. We've held events at Robbins Island. We've held events downstairs in our multi-purpose room. But this year, I was able to find or have the Stingers host us at a game this year. So it's June 12th at 6:30. And so you're all invited. We have tickets for you. But this is a very special time for us because foster parents, like their job is like the most selfless job there is. And they often go unrecognized and they do so much for our children that we don't even see ourselves as workers. So We love to honor them. It's fun. They bring the kids, they bring foster kids and their own kids, the whole family, and we just appreciate them. And so this year, we'll be at the Stingers game, and so hopefully you all come. If you have people interested in, if you ever heard family or friends be interested in what foster care is, please invite them. Tina and I will be sitting in a little booth. We'll have information, our cards, and so we'd really like to get our face out there. We are very low on traditional homes, not our relative homes, and so we really are going to try really hard this year to recruit some families. So with that being said, hope to see y'all there.
Thank you for that invite. Did anybody have any questions?
I got a question.
Go ahead, Dwayne.
So,
Or Commissioner Anderson.
Thanks, Mr. Chair. So you talk about you're trying to recruit more. How much of a shortage do you have for foster parents?
We are down significantly, so a lot of the families that we have had in recent years have adopted a lot of kids. And so they're at their max capacity and they can't take on any further children. And so we only have 10 traditional homes right now, and we used to have many more. I remember being an ongoing worker and I had a list to go off of. Now it's just a short little list. And so we really do value those homes, even though our goal is to place with relatives right off the bat, but sometimes that can't happen. And so we need a short-term placement while we look for a safe family relative.
Thank you.
And I'm sure, and maybe Constance will talk about this, or maybe you don't want to talk about it, but there's some discussion taking place, and Commissioner Gardner would recall recently at AMC board meeting, they talked about the challenges that have been in the news regarding out-of-home placements and whether or not they're being done on time, and having some rules that might look like the ICWA rules in terms of based on poverty and what was the other one?
Mental
People of,
mental health.
and it's going to be really difficult for counties in Hennepin County and Ramsey County. Thanks to them, they are funding their own pilot projects, and hopefully it'll be a common sense solution that comes out of that program that Ramsey and Hennepin are doing. And if you get a chance to show your appreciation to the commissioners from those two counties, they're kind of taking a bullet for the whole state right now. So thank you for your presentation.
Thank you for your time.
In an effort to keep us moving, I could keep going, but I will offer, I'll offer an opportunity if you have any other questions. Otherwise, I would love to read the proclamation for you regarding, all right. National Foster Care Month, May 2024. Whereas the family, serving as the primary source of love, identity, self-esteem, and support, is the very foundation of our communities and our state. And whereas in Candy, Ojai County, there are currently around 150 children and youth in foster care being provided with a safe, secure, and stable home, along with the compassion and nurture of a foster family. And whereas Candy, Ojai County has many dedicated traditional and relative foster families who give generously of themselves to provide nurturing, safety, guidance, hope, and love for children and families in need. And whereas foster, kinship, and adoptive families who open their homes and hearts to support children whose families are in crisis play a vital role in helping children and families heal and reconnect, thereby launching young people into successful adulthood. And whereas there are numerous individuals and public and private organizations who work to increase public awareness of the needs of children in and leaving foster care, as well as the enduring and valuable contribution of foster parents. Therefore, the Candy, Ojai County Board does hereby proclaim May 2024 as Foster Care Month in Candy, Ojai County, and urges all citizens to volunteer their talents and energies on behalf of children in foster care, foster parents, and the child welfare professional staff working with them during this month and throughout the year.
Thank you. I'd entertain a motion for this proclamation, accepting this proclamation.
Mr. Chair, I'll make the motion.
Commissioner Dale Anderson moves on National Foster Care Proclamation Month, May 2024. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any comments or questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. And I didn't hear you have enough courage to try to pronounce my name, so we'll just. Oh, you're gonna take a break here, but I get that all the time.
I just want to say thank you. Actually, I think all the commissioners would agree that this time, I look forward to May when we have all these proclamations. And I think it's really a great chance not only to highlight our staff and what an important service you provide, but for the public to know that, our county government is really interested in and very helpful in these areas, and there's a need out there for what we're providing and where their dollars are going. So thank you so much, and thank you for the updates, too. They were very excellent. Appreciate it.
Thank you
Thanks
for
to all
having
of
us.
you. If you'd have to come up to the podium if you want to raise your hand, but you're welcome.
Thank you. Commissioner Imdeck, if you guys would be willing to take a photo with our unit for the Facebook page and for the Candiota County newsletter so that we continue to promote May as Mental Health Awareness Month and for all of us to take care of each other, we would appreciate that.
I can't speak for everybody, but I'm more than willing. We'll do that on a break. So we'll take a 5 to 8
Okay,
minute
all right.
break.
Okay.
We'll reconvene the Kansas County Board of Commissioners meeting. Next up on the agenda is the United Community Action Partnership Contract Addendum. And Jolyn will be presenting on that.
Good morning.
Good morning.
Lauren,
I'm Jolyn Sundstrom. I'm the Children's Services Manager, and I'm here to do an addendum to our UCAP, or United Community Action Partnership contract. Right now, our contract is up to $150,000, and that includes our in-home family-based skills, so they're providing parenting skills to families in their homes, mainly our child welfare, child protection families, and some of our children's mental health families. In addition, they provide parent support outreach program services. So those services come from screened out reports or community resources. And with the PSOP, we get a allocation from the state each year, which is dependent on the number of cases we have. So originally in 2024, our grant allocation, or our allocation, it isn't a grant, our allocation was $24,344. We were notified in the last month or so from the state that they increased our allocation by about $18,274. And in addition, we received the Families First Prevention Services Act is also doing some prevention services for counties. And so we received some additional funds from them that we could put towards a variety of services. In Kansas County, we chose to expand our PSOP program with those funds. So currently, PSOP can only serve children 10 years and younger. With the extension, we can serve children 11 to 17 as well. And we were able to put $17,234 towards that. So I'm asking for a contract change of a total of, sorry, I don't have the amount right in front of me. Let me look. $185,500. And we would be using those allocations towards that. It wouldn't be any county levy funds going towards that, just strictly putting those allocations towards that, so we can use that towards PSOP.
And to be clear, these are additional funds granted to us that we will then enter into contract with UCAP to provide those services.
That's correct.
Just wanted to be clear on that. So this requires action. I'd entertain a motion to accept this amended contract.
Mr. Chair, I would like to make a motion that we accept this amended or addendum to the contract with UCAP.
Commissioner Dwayne Anderson moves on the amended contract with UCAP, the addendum. Do I hear a second?
Mr. Chair, I'll second that.
Commissioner Berg seconds. Any questions or comments? I have one question. Maybe it's more for Commissioner Anderson, because you serve on the UCAP board. I worry all the time that we stretch just like everybody else is stretched in the ability to provide the service given in this workforce situation that we're in. UCAP has the facility, or has the capacity for additional work and contracts, I take it.
Yeah, I guess that'd be a question
Maybe it's
for
not a fair
Heather
question
maybe,
for you.
or Deb Brandt maybe, so.
Okay,
And Heather and Leanne.
save that question.
Yeah,
Okay.
they're going to present next about the PSOP and family-based program.
Okay, thank you. All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thanks, Jolynn.
Thanks. And I would just like to say we have a great partnership with UCAP, with Heather and Leanne. Shelley Sturzinger also does in-home and PSOP. Both Leanne and Shelley have done in-home and PSOP for many, many years. They bring a great deal of experience, and they're always going to many trainings to increase their knowledge to support the families, and very much appreciate the partnership and the conversation with them.
Thank you. All right, well, that was a good segue into our next presentation.
Okay. Well, I'm not going to say a whole lot. I know you've seen me here before. That might surprise
What I'm going to ask you to do, both of you, is to introduce yourself and who you are associated with.
Yeah. I'm Heather Jesuits. I'm the Community Services Director at United Community Action Partnership. I've been there 22 years-ish, and I guess I oversee the PSOP family-based services and work with Leanne and Shelley. And we also have, who actually collectively have just shy of 50 years experience between the two of them. Which is weird because you're only 29. And then we also have Noemi Flores, who is Spanish-English bilingual, and that is something new in the past 18 months that we've been able to provide PSOP and family-based services in first language, which we know lots of things get missed in translation, and these services and the needs and goals of families is just so critical. So that's been a real blessing. And then we also have Chalar, who is Korean speaking, and we've seen an influx of the need for Korean speaking services. So she does translation services for Noemi, Shelley, and Leanne when they're out doing PSOP and family-based services. So I'm going to let Leanne, as the expert, share what those programs do, how they work with families.
Welcome.
Thanks. I'm Leanne Stoffenecker, and I've been at UCAP for 18 years, and then Shelley, my coworker, has been there for 25. And so the first part I'm going to talk about is PSOP, which is the Parent Support Outreach Program, and it is a voluntary program for families with children of all ages. And Jolynn had spoken about that we used to only be able to work with families with children 10 and under, and now with this new grant, we can now work with all ages, which really opens up more families for us. So referrals are made to UCAP by the county, by schools, by Head Start, and even other UCAP individuals. So maybe our housing people might be meeting with a family that talks about just needing more resources, needing some guidance, needs some parenting skills. Our outreach individuals have also been able to refer to us. And so the program is very family driven in that they express what they need the most, and then we work with them to kind of alleviate a lot of those stressors, hopefully alleviate those stressors in their lives. And so we do parenting skills, so we're helping them set up routines, following through with the rules of the house, and we go through like ages and stages, so the expectations of what they are looking for from their children coincide with their age. We do organizing, so we have bot containers, we buy file boxes. And I mean, some of this is like, well, yeah, why wouldn't you have that? But these individuals, they will just have papers, everywhere. And so we get file boxes, we sort it, we get them kind of organized. We buy calendars, alarm clocks, so we can get up for school. Cork boards, we're putting notes on there, just to try and make their daily lives just a little bit easier and not so chaotic. We advocate for them, but we also teach them how to advocate. So we're going through scripts on what do you say when you call your landlord, if you're behind on your utility bill, if you need to talk to a children's mental health worker. And so we're always just trying to teach them just a little bit more so they can do this without us. We hand out millions of community resources. We talk about nutrition, safety. We've bought them life vests. So now with summer coming up, that's what we're looking at, bike helmets, because a lot of them have bikes and off they go. And so helmets are something that we're really trying to get them wearing. And then we just try and set them up so that when we kind of let them go, they're good to go. And if not, they also have had just a really good relationship with us that they call us. And I do get probably 4 calls a year from old families. Hey, Leanne, can you help me with this? Or where can I get this? Can you come back? And so then I go back, work with them a little bit, and then kind of we send our little ducklings off again. And so the program is intended to be a short-term program. However, there are times when we have stayed a little bit longer, but that's kind of a family-to-family basis. We often, or all the time, have to do a lot of paperwork. So we are filling out all of the necessary paperwork that the county needs to be our fiscal agent and to kind of keep on track with what the state is asking them to complete. We do case notes, goal sheets, and then at the end of our PSOP workings, we do a final report, and that is also given to the county so they kind of can see that what we are doing with the families. And like I said earlier, we now get to work with all ages. And so we're hoping we get a lot more PSOP families in that way. The other program that we have is our family-based program, and that is, the PSOP family does not have a social worker in it. Family-based has a social worker, and those referrals only come from the county. And so they are asking Shelley and I or Noemi, can you guys go in and this is what you have to work on? And the family can say, I don't want to work on that. This is what you're working on. Where in PSOP, they get to kind of ask and say what they want to work on. And so we team up with the social workers here at the county and mainly focusing on parenting skills. We're working on getting rid of abuse, neglect, truancy, and those are kind of the main objectives of the program. And so this program is a little bit less family-driven than the PSOP program in that the county is saying, this is what you guys need to work on. And we write monthly reports so that the social workers know what's going on, but we also are texting them, we're calling them. We're having face-to-face meetings once a month with social workers so that we're always kind of working as a team. And then this program is a little bit more intense, and there are times that we have been subpoenaed by the county to appear in court, and then we kind of have to go there and talk about, how is this family doing and what's not going well and what's working. But other than that, that's it. In a nutshell, right?
Yeah, in a nutshell. So, did you have more that you wanted to
I was
present?
just going to answer your question formally.
Okay, yes, please.
So with all that said, UCAP definitely has capacity to handle more. Not to say that they're bored, but we believe in meeting the needs and partnering. And so if meeting those needs, receiving more funding allows us to staff up, get more hours to some of our, like Noemi works part-time with this program, allowing more and juggling, we're willing and wanting to do that to make sure that the needs are met. So capacity is not a concern.
Thank you.
Yeah.
Any questions for Heather or Leah? Commissioner Anderson?
Yeah, thanks, Mr. Chair. I kind of have a comment, and I don't know if it's really related to this, but it is about UCAP, and they do provide a lot of good services, and one of them is they help people do taxes. Some people have never done their own taxes before or done taxes, period. And at first you go, well, why should they be doing that? But what happens then is you get a lot of volunteers that help people prepare their taxes, and they don't realize this, but they were paying taxes all along, but now they get a refund. And so then that refund goes back in their pocket, and then they can spend it back in the community. So it really helps more than just the individual. It helps the community, businesses, and all that with the money that comes back to the area.
Yeah, and I think, Commissioner Anderson, you bring up a great point, that one of the other reasons UCAP is a great fit with this partnership is because of the vast amount of resources that we have in-house and the connections within the community. So when they're working with the families, they're working on these goals, whether they're family-focused or community or county-driven, but we're really connecting them with a whole plethora of different resources and services on kind of a one-stop shop. So it's really a great partnership in that sense.
I was, as a new commissioner, I had almost no clue that UCAP even existed, and was kind of blown away by the services you provide. You talked about tax preparation, but also the automobile program where you try to get somebody a working automobile, which is the number one hindrance for someone keeping a job. Energy efficiency, whether they own their home or paying the energy bills in a rented place. It's amazing what you do. I'm interested again, same question I asked earlier, is what would the school involvement, because you're a multi-county agency, and so there's a lot of schools involved, but especially now that you're going from 11 to 17, you're gonna, even at the earlier age, your school was obviously involved. Can you talk about that just a little bit?
Absolutely. So, every school district in Minnesota, so we also do homelessness, right? Homelessness and housing. And so there's homeless liaisons within every school district in the state of Minnesota. So one, we're connected really close there. The ladies are in weekly contact with the school social workers, truancy officers, and making referrals. And truly, just in the past couple of weeks when we've received this additional funding, our referrals on the school-age kids have doubled in what we're seeing. So now we're kind of making those connections. Like we may be able to tap into some of those families with the older kids. So they work ongoing. And then with our enrolled families in PSOP or family base, they'll work with the IEP teams. They'll attend the IEP meetings with families if they're, in special ed programming or anything like that. So very, very good working relationships with the school district.
And how about nonprofit organizations in communities like Kennewick County Food Shelf or the Link up at New London and other places like that, that I'm sure exist in other communities as well?
So we're also talking, we talk monthly, we have community resource meetings where we'll get together with other providers and talk about what's new, what's happening, what's changed. We have staff that go into every week to the Candido County Food Shelf, not because we have to, but because it's a great connection point for families and meeting those gaps. We work with like the Ware Mary Community Foundation and meeting some gaps. We got some funding from them for safety needs, the bike helmets, the life vests, and different things that we can maybe help families with. So we're really connected there. And same with the link. Actually, both Shelley and Leanne live in that area, so they're very well connected with the link. So yeah, we just really stay in contact with them, making sure they know what we can do and how their services could also help our families.
Thank you.
I shall say too that we only do this program in Candido County, and then we dabble a little bit in Family Base and Meeker, and so we're really specialized into this community. So we talk that UCAP has a huge footprint of 13 counties, 9 with 4 extended, but we specialize this here. This is a unique partnership to UCAP here in Candido County, which is really cool. So yeah, all of their time and efforts are 100% focused here in Candido High, and then we have one staff that dabbles just a little bit with a contract through Meeker.
Thank you for that distinction.
Yeah.
Any other comments or questions? Well, I just want to thank you guys for coming forward and giving us an opportunity to learn a little bit more, be reminded of the work that you guys do. So, thank you.
Thanks.
All right, we're going to switch gears here a little bit to Community Crime Intervention and Prevention Grant Contract. Ms. Lieberg, and before you go into your contract, I understand there may be something that you want to talk about.
And I think there's something you want me to talk about, but I guess, yeah. So in the last 2 weeks, I defended my dissertation and officially earned my doctorate after years of research in law enforcement and PTSD and stress. It's kind of exciting to finally be done and have all that completed. So yeah, my doctorate was completed as of now.
Well, congratulations
Thank
on
you.
that achievement. So,
Yeah. So I am actually here to talk about a grant instead. So I'm Tammy Jo Lieberg. I'm the Director at Community Corrections. I'm looking at accepting the contract for this grant. So I'm just going to give you a little background on the grant and the ideas behind it. We actually wrote this grant almost at the same time as we wrote the opioid grant, within actually a couple weeks of each other. And so our intention was to complement some of the things we were doing in that program and then add things to our own, to our program at Community Corrections. At the time, we had actually requested dollars. There was 2 sides of this that I'm going to talk about, by the way. One was evidence-based practice training, and the other side of it is emergency transition services. Now, the evidence-based practice training, we'd actually asked for dollars to have a evidence-based coordinator within the department to do in-house training and different things that we'd be able to do. When the grant actually came back to us, due to the large amount of people that had applied for the grant and a variety of different things, we were awarded the grant, but they reduced the amount of money that we were going to receive. We'd requested $240 and we got $121,000. So that meant, since they awarded the grant, that we kind of went back and went, okay, so what do we need to do differently to look at how to make this program work that we had envisioned with half the amount of dollars that we are. And I'm pleased to say, I think we have a really, really good plans and ideas on the table. Instead of hiring a in-house person, we're looking at doing some contracts. One of them will be with one of our retired probation officers to come co-facilitate some cognitive behavioral groups. We're also looking at bringing in some training for countywide for jail staff, law enforcement, social services, and probation staff on evidence-based practices, and some coaching, individual coaching, because a lot of the things that we do working one-on-one with probationers also is skill building of how do we develop those cognitive-based skills with those individuals. Well, for probation officers to really develop that level of skill, sometimes coaching is a better model than the training. So we're looking at changing that part of the grant into more of a training, coaching model on a contract basis instead of a person. The other side of the grant is emergency transition services that we're looking at. You can talk to any probation officer and probably any law enforcement officer. It's one of those things that happens in our world at 4 o'clock on a Friday afternoon. Somebody gets released from jail and shows up at our office and says, I have nowhere to go. And so, or from prison, like they will be dropped off on the bus and they show up at our office. Sometimes that means they show up at our office at 4 o'clock in the middle of winter without a coat or decent shoes, or because they went to jail or prison at the time when it was warm and now they get released when it's cold. They may or may not have family in the area or options or different things. Places like actually UCAP and lots of other community places provide a lot of assistance for our individuals at that level, but sometimes at that 4 o'clock mark, it's impossible to get somebody to actually help them find something right at that moment. So this grant is actually going to give us some dollars for emergency transportation, so if we have to get somebody to a homeless shelter, or if we have to get them to some place, to a family member or something, we have dollars to buy bus tickets or to provide some volunteer driver or something to get them someplace. So there's a pocket for emergency transportation. We also have some dollars for emergency hotel rooms to get us to the next day or 1 or 2 days, so that we have the ability to find them the type of assistance that they might need. And then I think there's some dollars for food and different things in there built in. And then lastly, we also added in there, we also know that when we have people doing, and we've talked about this before, we have a grant through PAC4 that assists us. We also added dollars in here to build incentives. Just like everything else, when we really want to change behaviors, it's the carrot and the stick is what's most effective. And sometimes, probation is looked at as we have the stick of going in and arresting people, they go to jail, those types of things. Sometimes it's more effective to actually provide a carrot too and say, if you can do this, what can we do to help you get that, to do better? And so what we built in as part of that is healthy types of ideas or things, small incentives. All I'm talking about here, I'm not talking about big things, I'm talking about things like literally you can go grocery shopping and buy vegetables with a gift card. Or maybe, you have your own car to get to our programs, but you need a gas card because you don't have the gas to get here. So those are the types of things that we built into this grant to provide both high-level evidence-based training and coaching for staff in the county, but also provide emergency services to the people that we serve.
Well, thank you, Dr. Lieber. Does anybody have any questions? Commissioner Gardner.
Thank you, Mr. Chair. Tammy Jo, thank you again, and once again, congratulations.
Thank you.
Just looking at the funding, you'd mentioned that the initial thought had been to create a new staff position. Did I understand that correctly?
Yes.
And this is going to be a contract position instead?
Temporary contract, yep.
Sure, and this runs through the end of 2025.
Yes.
Is there going to be some kind of expectation upon from the state of Minnesota or elsewhere that this continue past 2025? And if so, is that going to necessitate a full-time staff position?
At this point, no, not what we have planned. This is, there's the potential that we can reapply for the grant, so we could extend it out at that point, but there is no specific continuation beyond that. So no, we don't have any county dollars going towards this afterwards. We may look at what options we have to continue to provide some of these services, but at this point, it's really going to see what can we build here locally to make a difference today.
Just thinking about our budgetary concerns that we're going to have over the next 2 cycles, that's actually pretty good news for us for now. Thank you.
Yep.
Any other questions? I had the same questions, actually, whether this was a pilot program and if there would be ongoing funding and I suppose a determination will be made based on evidence-based practices, whether or not.
And we will
this
be doing reporting and going back and saying, okay, these are the things that we did. Some of the, like I kind of mentioned, is, originally looking at a position was what our initial thoughts were. But I'm pretty excited about the idea. We've started looking at some of the people that we can bring in as trainers and different things that we can share it now, not with just in my own department, but countywide with multiple departments and provide that type of training for everybody with this grant.
Thank you. Any other questions? Nope. Thanks for bringing that forward.
Thank you.
Is it an action
And
item?
congratulations. Oh, we got a contract.
Oh.
Yeah,
So we better,
Mr. Chair.
Entertain a motion to accept the contract.
Mr. Chair, I move that we approve the Community Crime Intervention and Prevention Grant contract.
We have a motion on the floor for the grant contract. Do I hear a second?
I'll second.
Commissioner Gardner seconds. Any further comments or questions? Hearing none, all in favor signify by saying aye.
Aye.
Both same sign. Motion carries. Thank you.
Thank you.
Thank you.
Up next, some bid awards. Mr. Odens.
Mr. Chair, members of the board, we have two bid awards for your consideration. Mel Odens, Public Works Director, Kansas County. The first one is County Road 7 on the west edge of Kansas County. It's our 3.5-mile grading project. We had 5 bids received on the online bidding that we have started 100% this year. We had 5 bids open on April 16. There is a detour on that project. Just so you know, County Road 7 is on the west edge, and we're gonna detour them to Pennock and then down 1 and then back. So that will be our detour, which will be starting sometime this summer. But it's my recommendation to award the contract to RNG Construction of Marshall, Minnesota in the low bid of $1,853,327.94.
You heard the recommendation of Public Works Director. How do you wish to proceed?
Mr. Chair, I'll make a motion to accept the contract to RNG Construction out of Marshall.
Commissioner Dwayne Anderson moves on the contract.
I'll second it.
Commissioner Dale Anderson seconds. I have a question. That goes right down to Minnesota Highway 40.
Correct. It goes from 40 up to 12.
And that intersection has been a bit of a challenge for some accidents. Is there any improvements going to be made in this process, or is it on the wrong side of 40?
No, actually, we added rumble strips. Our maintenance staff added rumble strips a few years ago after the accident, and we will put rumble strips back in when this project is complete. And then also, I believe, I can't remember if that's also got the flashing
Double stop signs?
stops. We have everything in place, I believe, except for a signal system.
All right. Very good, thank you. All in favor signify by saying aye.
Aye.
Both same sign. Motion carries. Now the bituminous surfacing.
So the next action is the urban bituminous surfacing we're doing in the city of Wilmer. It is all part of our local option sales tax. So we're doing the 2.5 miles of Wilmer Avenue in this case, or County Road 23 from all the way from the east edge of town by the bypass, all the way over to County Road 5 in the industrial park. And that will be we're gonna do it in 3 different phases. Maybe the thing to note there is the west phase from First Street to basically 22nd Street or Jenny O is going to be detoured starting after the 4th of July. We would accommodate cross traffic, but there is going to be a detour. That's probably not really well talked about or known by a lot of people, but that west section will be detoured starting after the 4th.
Yeah, that's a pretty major route. That
Yep.
businesses and schools and
Yep.
ball fields and that kind of stuff over there, so.
And then the piece from First Street to Bremer Bank is gonna we're just basically gonna close it down for 2 days and mill it and pave it, or maybe a short week. And then from there to the bypass is gonna be done under traffic.
And then a couple parking lots.
Yep, and then we're doing the downtown county office building, and then we're doing Salisbury Beach as well. And that's the local levy dollars that we're gonna be using. So with all that being said, we had 2 bidders. We opened bids on April 30th, once again online. And our recommendation is to award to the low bidder, Donick Incorporated out of Princeburg, for $2,137,681.49.
So you heard the recommendation from staff. How do you wish to proceed?
Mr. Chair, I'll move the recommendation of staff for the bid award.
Commissioner Gardner moves on the bituminous contract. Do I hear a second?
I'll second it.
Commissioner Berg seconds. Any questions or comments? Go ahead, I thought I heard you say two.
Yeah, but I'll let him go
You go
first. Maybe you have the same question.
Just a brief question for you, Mel. We've done pretty well on bid awards so far, coming in under engineers' estimates. This one comes in just a little over. Is there some particular complexity to this project that necessitates that?
It's urban work. You know, we are, the biggest thing that we estimated at $80 a ton for mix, and it came in at 89. And so, and this is about a 30,000 ton project, and so that's basically it. The good part is it's local option sales tax. We're not dipping into a levy or our state aid account. So we have the funds available. And then also, there's a little bit, there's work with the detour, there's work with the different segments, and then there's work with coordinating the signal systems. We have 3 signal systems that we have to coordinate.
Sounds reasonable
So we get
enough.
some subs in there, Design Electric, et cetera. Yep.
Okay, thank you.
Yep.
Other questions?
Yes, that was a good question. I was thinking that as well. And I'm just curious, there's this gap on Wilmer Avenue. It's over by Bethesda Home, where you're going down Wilmer Avenue. There's a gap you're not doing then, correct?
No, actually, that's the word 23.
Well, right.
It does look like a gap. I'm looking over his shoulder.
Oh, it's all blurry, so I don't
Yes,
know.
I'm sorry.
I got you now.
I
Okay.
apologize. It's the title sheet, and we left County Road 23 in there. It does look like a gap.
Well, it didn't look like why? Perfect, thank you.
Now that we know the whole road is being done, do
Yep.
we have a motion on this one yet?
Yes, we
Yes, we
Yeah,
do.
okay.
Yep.
Any other questions or comments? All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Mine is so blurry.
Yeah, mine's blurry too.
I thought the same. You did that. All right, we have one more item, the item we added to the agenda. Mr. Otis King, please come to the podium and introduce yourself and what you're representing.
Good morning.
Blurry, yeah.
I'm Dr. Otis King with County Okai Emergency Management. I've been on station here for about 3.5 weeks or so. So looking forward to anything that I can assist the county with and along with our regional partners. So if you have any questions for me, I'm happy to take them.
Commissioner Gardner.
Thank you, Mr. Chair. Dr. King, first of all, thank you and welcome. And that was an interesting way of saying you've been here, you've been on station. You have a background that, if you would feel free to share that with us, with the military, correct?
Yes, sir. 22 years Air Force, just retired. I'm on terminal leave, so technically I'm still active duty for the next couple of months. But I built up enough time off that I got out a little bit early. So my last station was Ramstein Air Base in Germany. And there I was the manager for strategic integration and future capabilities for U.S. Air Forces in Europe and Africa, dealing with nuclear command and control and communication systems, and command and control for Europe and Africa. I also served as the command staff member for the European Command Joint Response Task Force, dealing with incidents that would be in the area of operations that would require a general or a flag officer to go out and handle an incident that required our support. Before that, I was the senior enlisted leader for Special Operations Command Central in the Middle East, handling operations there for a year prior to that.
Thank you. Any other comments or questions? No. Other than I also would like to extend our welcome to you. And I did take his, I don't know, took us about a half an hour tour the other day of the building. It'd been a few years since I've been in there, when I think the last time, maybe the second last time, we had bird flu. But I didn't see behind some of the doors that are there. And one that intrigued me a little bit was the ham radio operators have a spot in there, so if all the traditional communications go down, they, as I understand it, will serve as a backup, so.
Yes, sir.
Yes, so welcome aboard and thanks for coming in.
Thank you all.
Oh, wait.
No, we're good. Go ahead.
All right. All right, does anybody need a break before we go to report outs? All right, then we will move forward with report outs. Administrator Baker, do you want to cover the calendar first so we don't forget it?
Yes, so this would be changing our the structure of our meeting, so we would need approval, and we could probably do a joint approval if it would be okay to move the June 18th regular board meeting to 4:30 PM. We did that last year, so you didn't have to come in twice. And that's also the day of the Board of Appeal and Equalization meeting that by statute has to start at 6 PM. And so we would just do our regular board meeting at 4:30 and then go into the Board of Appeal and Equalization. The other one was a request to approval to move the July 16th regular board meeting due to the National County Association Conference. We have 2 commissioners attending. They will be coming back that day, that we would move that to July 18th at 9 AM. I almost said 9 PM, 9 AM.
So, can we do this in one motion?
Yep.
We don't need a resolution. Okay. So I'd entertain a motion to accept those board schedule changes for June 18th and July 16th.
Also moved.
So Commissioner Dwayne Anderson, or Dale Anderson moves, Commissioner Gardner seconds. Any discussion? You've all had a chance. I guess we already talked about the July one, and this one we're scheduled anyway. We do have Woodland Centers mental health housing earlier in that afternoon.
At 1 o'clock.
Yep.
That is,
Yeah, but, so we'll have to fill a gap in between there, or go back home and come back.
yeah,
So-
that's like a 1 o'clock meeting.
Yep.
Right?
All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Okay, then we will go to report outs. I'll start
Yes,
with.
Mr.
Oh,
Chair.
Go ahead. You can start then.
What day are you talking about, Woodland Centers one? Or for the July one?
July 1, yep.
Yeah, I was looking at June. Thank you.
Okay. Commissioner Dale Anderson, would you like to start? for
Sure.
report outs?
Not a lot that I had. Me and Dwayne did open mic on the 17th of April. Interesting adventure because they had their AM tower down and they did not, we had to do it in the newsroom, so it was a completely different thing, and it was kind of just freewheeling it because he didn't have the stuff that he normally did, but we made it, got through it, and it went well. But I'll let Dwayne talk about the library meeting we had on the 18th. The 19th, I had a Chippewa watershed meeting, and we had an open meeting that day for anybody from the public that wanted to have comment on the watershed plan. We had a pretty big crowd. Nobody really said much, but there was quite a few people there, kind of unexpected amount of people showed up for that open meeting. But I think the plan's coming together. Hopefully by the end of the year, we'll have that plan completed and have some funding available for Chippewa watershed. The other meeting I had would be tourism meeting yesterday. There's a lot of stuff going on in the county. The big thing that everybody in the public, I guess, needs to know is that if you want to go camping this summer, get your reservations in because there's a lot of camping already signed up and things are going to be getting full, I think. There's a lot of activities for the county for the summer coming up. And there's a lot of opportunities that are coming up. There's getting to be some rentals of some bikes in the area so people can use our trails for the bike trails. There is just a lot of different activities I thought that were really interesting that are going to be going on. There's been some renaming of a facility, and I'll just leave it with that. It'll be coming in the news, but yeah, just interesting things I think that are going to come for the summer. The one thing that they did talk about in a little bit of length was that the fireworks for the 4th of July will be shot out of a different place because of new regulations and safety concerns. So keep an eye out for that to see. I think they still feel that everybody will be able to see them fine, but they're going to be shot out from the backside of the Middle Fork Watershed building is where they're going to shoot them off of that hill back there. So, but yeah, look at your calendar, look at the websites, and take advantage of what's all going on in the county.
And as a reminder related to the camping, Sibley State Park's Lakeside Campground was closed this summer due to reconstruction. Commissioner Gardner.
Thank you, Mr. Chair. Catching up a little bit on some items, meetings and other events. Was able to take in the League of Women Voters Forum where Secretary of State Steve Simon talked about elections back on the 17th of last month. On the 18th, we had a EDC review committee to finalize the parameters and the posting for the executive director position. I'm told that we have a good number of applicants already for that position, and that's still open now for I guess about another week and a half or so yet. And then I also had a Humane Society Executive Committee meeting that day. On the 19th, attended the AMC Board of Directors meeting in St. Paul. We received various legislative updates there. There was some interesting discussion as related to the tax forfeiture issue that all counties are facing and the legislature is trying to work through. On the 25th, Commissioner Berg and I'll let him speak more at length on this one, had the Woodland Centers retreat that we were able to attend until we had to leave for the EDC Joint Powers meeting. And then after that, we had the Woodland Centers board meeting later in the afternoon. Took in the Healthy Kids event at the Civic Center. That was a lot of fun on that Saturday. And then Health and Human Services Committee meeting, and again, I'll defer to Corky on that one as well. We had our initial meeting that day, and then had a West Central Industries board meeting via Zoom as well. Supporting Hands Nurse Family Partnership, we met yesterday, and one of the items to come out of that is that there is an expansion proposal that was approved to help provide additional capacity here in Candiota County specifically. Supporting Hands, of course, works with expectant mothers and their children up to basically the age of 2, and we are the largest contributor to and user of that of those services. So we're looking at an additional, I want to say it's either 7 or 8 tenths time position for a nurse home visitor, and then also potentially an outreach coordinator as well, depending upon the how the funding pans out for that. So we have that. I also wanted to make a couple of notes real quick. We had Dr. Chose in here earlier, and she mentioned their community impact team. One of those members of that team is John Salgado Maldonado, who also happens to be quite an accomplished artist. And he has an exhibit that is going to be shown at the state capitol beginning on. Go ahead. Okay, sorry. I'm looking to see if I had something in my teeth. He's got a art exhibit featuring the city of Willmar in the state capitol beginning on Thursday. And I know there's going to be an event down there kicking that off, and that'll be interesting. And I also wanted to, we heard about childcare very briefly, and just something that we heard at economic development here last week. We've received updated information from First Children's Finance. They do a lot of work in helping to measure and determine the need for childcare slots across their service territory. And it had been not that terribly long ago that we had a need for, first it was about 800 childcare slots across Candiota County, then it was about $950. With our ARPA funding and other efforts that have been coordinated through the EDC and our other partners like UCAP, we've created about 265 slots. However, economic development and more people moving into the area, well, now the need is for, just for birth to 5 is about 1,046 childcare slots. And when you add in school age groups, we need about 1,400 in Candy, Ohio County. So the need continues, the need for funding for childcare continues. I'm hearing from folks who have family-based childcare businesses, and they're extremely concerned about additional regulation of those businesses coming down from DHS. There's a 90-some page document of proposed changes coming to that, and it may discourage a lot of folks from going the family-based route. I know that DHS is wanting to push the center-based models more because, frankly, there's probably some economy of scale there. But we still need to find a way to continue to help our family-based providers as well. And the last thing that I had. Commissioner Berg and I, well, you're not going to be on the bus with us apparently, but we're going to be going on a tour tomorrow with some of our senior staff and other community partners to tour the Scout County Community and Family Resource Center. That's something that we've heard about over the past couple of years at our AMC annual conference. And I think it's really fitting considering all of the different organizations that we had in here today and all of the different areas that they cover. I think it's just extremely interesting that a community resource center like this, family resource center like this, would likely entail partnerships with organizations like them. So we're looking forward to that tomorrow, and that's all I have.
Thank you. Commissioner Burton.
Oh, okay, I'll go next. First off, I just want to mention that on the 16th, after our board meeting last time, we had our budget work session, and I just felt we had a really good discussion, and it's a good step to go forward with our budget, and I feel very positive about that. I also attended Commissioner Simon's presentation about elections coming up, and he's been here at least a couple of times, if not more than I ever remember. And just maybe this might be a time just to mention to the public too that they still can use more election judges, and there is a stipend that goes with that, and training, and it's not a big time commitment, but that day gets very long. But I encourage people to explore and check with the county and or the cities for the election if you're interested. I had the Prairie Lakes Youth Program also on that same day, and just really not too many comments other than that they got a lot of things on their plate right now, looking at what the needs are for our space and either remodeling, upgrading, or moving there, and the needs for the different services we're providing. And financially, they're fairly stable right now, and we're feeling really positive about that. And we provide services throughout the whole state that kids come there, but really it's such an asset for our region that our kids can go there and our sheriffs don't have to haul them off to some other county for their needs. Also on the 18th, we had a JD Ditch #1 meeting here in the board with Commissioner Dwayne Anderson and Commissioner Roger Emdak, and it was a fairly long meeting, I should say, but a very good discussion, and I just feel it went for over an hour, I believe, and that the end results, it's just a step, but I think all parties are pretty agreeable to work together on this and as we move forward. So we'll see what the next meeting will be like, and that's down the road. But it's a very, very good meeting. And it was well done. And in the fact that we had a Zoom meeting, one of the commissioners on that board had to do by Zoom. And it worked really quite well, considering it worked quite well. And also, our attorney was on Zoom as well, and it worked out quite well in this room. I attended Richard Falk's funeral, and I only bring that up because that's not a committee at all, but Richard Falk was a former commissioner back in the 2001, 2000, or right in that range there for several years, and I believe he was a chair of the board when they built the jail. So unfortunately, he had some health problems, and he passed away recently. I had a law library meeting, and we are looking at, we're going to really, we spent a lot of time, unfortunately, talking about pictures for the courthouse building, and especially for the law library. And anyway, we're making some progress on that, and we are going to be moving forward, and I believe Administrator Baker will be at our next meeting to maybe help with that. So I appreciate that as well. And then also looking at some other things they could do as a law library to help out the individuals that need those services. And they got several ideas, but I won't share any of those right now. And we had the Woodland Centers, as Commissioner Gardner mentioned. That was a meeting practically the whole day. They had a retreat that day, and then there was the EDC meeting, and then I had the Finance Committee meeting for Woodlands before the regular board meeting. But it was a very good meeting, and they're doing well. And then we had our first meeting, Commissioner Gardner and myself, with Health and Human Services subcommittee meeting, and it was a very good meeting, a good sharing of interests and concerns of, what would be the board interested in for information, and what did they want to share with us. And they did share some really good, and we set up some future dates. So it was a very positive experience in going forward. So, and then I had a Hawk Creek project, as well as a Hawk Creek One Watershed Plan meetings. There were two separate joint powers boards, but it had it on the same day, one after the other. And we had a couple major projects as a board to decide upon because of dollar-wise, and it was for cover crops. And we had an update about, by doing this, how much of the chemicals that we're saving that are not going into the water system, that we don't want to go in there, let's put it that way. I had a Prime West meeting on the 2nd, and that practically takes a whole day. When it's in Alexandria, you got to drive up there and you drive back, and they're usually pretty long meetings. And a lot of time was spent this meeting that every board's so different. But budget-wise, they look at their quarterly budget reports, and being the first budget of the year, quarter, we spent a lot of time talking about readjusting the budget and going forward from there. And they felt the importance of updating the board of what was going on and taking place, and we needed to know that. There was a EDC meeting at Heritage Bank. That's the one you guys went to. I don't think I did, right? If I remember right, Commissioner.
Okay.
I had it on my calendar. Oh, no, Joint Ops Board. I did have a Joint Ops Board, yes. It just gets me so many, they kind of all run together. I had a Joint Ops Board.
I didn't remember that.
Yeah, right. And that was on the 9th, and that was a very good meeting as well. And I guess that's pretty much it. Thank you, I'm done.
Thank you, Commissioner Dwayne Anderson.
Jumped ahead, didn't I?
Okay, yep, I had more meetings than I thought I did. It seemed like I had a light load, but actually I had quite a few here when I'm looking back. But I met with Drug Free Coalition, and we're basicly every meeting we bring up about, actually Commissioner Steve Gardner showed up to address, or talk about his concerns about the new cannabis law, and maybe what can we do about it. So I know Administrator Baker is looking into kind of our options, and actually you're going to sit down and talk with a few people in the county staff about what we can do, or what our roles are, what the different roles are going to be moving forward. I also met with Economic Development Committee Broadband, and things are moving forward very fast, it seems, with some of our fiber projects in the county. I know Lake Elizabeth and East Lake Lane Township, they are putting fiber in the ground, and they're putting in what they call sleeves across approaches and stuff to prepare for when they do lay in the fiber in the area, which is really encouraging. And then also there's going to be resubmitting of applications. The deadline is, I believe, Friday. Isn't it Friday for?
The 10th, yeah.
Yeah, the 10th. So that's moving forward, and we're crossing our fingers and toes so that we can have some more grants going forward to put in more fiber in the future. Met with UCAP, and I won't discuss that because we discussed that pretty much at length today. I went on a county park tour with Commissioner Dale Anderson. I think that was on April 26th, and it was kind of a cold and wet day, but we worked our way through it. And I just want to tell people we have great parks in the county here, and go camping and go spend some time. If you don't camp, just go hang out at one of our county parks this summer a little bit and just enjoy the great parks that we have. Let's see, I watched bid contracts for bituminous. I believe that was the one that we accepted today. That's kind of interesting to see it happen live. And then I had a Pioneer Land Library meeting where we had the audit report, and it came out as a clean audit. So that was kind of encouraging, and I guess it's always nice to have a clean audit. We also, I did meet with a couple other commissioners here with the JD1 where it was someone closed off a portion of the ditch. I want to give a hat tip to Austin Hillbrands, our new drainage inspector. He's really stepping forward and doing a good job, I believe, and it kind of puts us in a bad situation where we kind of look like the bad guy when we have to take action on something that someone did something with a county drainage system that they weren't supposed to do, and now we're trying to resolve that. But he's done a good job, and he's really looking into it good, and so we're going to hopefully have a good way to resolve this issue moving forward. And then also I was on open mic with Commissioner Dale Anderson. He kind of talked a little bit about how we were in the newsroom, the JP Cola called it, and we had to share one mic, and it was a little different because they got a little bit of updating and stuff with their control panels and stuff, and we couldn't use the usual room that we had. So it was kind of an interesting day, and then their tower was down, so the AM station wasn't working that day, but we were on the FM station. So I guess that's all I have for my reports. So.
Thank you. The nice thing about going last is that some of these things have already been reported on. And if it seems like it's a long time, it's been a long time, because we could have only had one more possible day between board meetings than what we had this time, because last meeting was on the 16th, this one's on the 7th, so almost 3 full weeks between. That's why we have a lot to report. On the 17th, when Steve Simon, Secretary of State Steve Simon was here, I was down in Mankato for Home Run Leadership that was offered by Association of Minnesota Counties. It's a very simple but effective decision-making process, and I understand that there's 2 or 3 of us that are still going to see attend the one in Staples on the 23rd of May, I think it is. Yep. And ironically, the very next day, and we've already talked about JD1 twice today, but I'm going to mention it again because it was a very thoughtful and effective resolution of what was going on. And it occurred to me that we had intuitively used the process that we learned about the day before in the leadership program. So I'm basically, gathering the information and looking at the reactions and then considering our options and coming to a decision. And that's basically what Home Run Leadership is about. So I think you're going to enjoy that. As Commissioner Gardner said, I attended the AMC board meeting. He mentioned the tax forfeiture thing. There's really 2 parts to what's going on in the legislature. One is the amount of money that is available to counties in the state of Minnesota for settling back suits, back claims. There's $109 million that will be allocated it on a formula, I suppose, like usually is, for meeting those. And I think the look back is 5 years that a claimant can go back on. I don't know how many the county will have, but I'll be surprised if we don't have one or two, where somebody will say, hey, I didn't get my fair share when you sold the property. So there's that. And then the other part of it is, what do we do moving forward? So if we have to mitigate a property, are we gonna get our costs out of it? And once we sell it, there's a lot of tails involved in how we're gonna handle it moving forward. And so the legislature is working on those rules going forward. On the 22nd, I was at a counties providing technology meeting to approve updated bylaws. It was actually a special meeting, but for updating and approving the bylaws. On the 20th, also that day, in the evening, I went to a Glacial Lake Sanitary Sewer and Water District meeting. And the highlight of that meeting, it was a very short meeting, but the highlight of that meeting was, and Corey Smith was a little too shy to show up and talk about it here, but the staff there received a certificate of commendation from the Minnesota Pollution Control Agency for the, says this wastewater treatment facility operational award is presented to Glacial Lakes Sanitary Sewer and Water Districts and its staff in recognition of exceptional compliance with its Minnesota Pollution Control Agency wastewater permit during the 2023 review period. So congratulations to them for that. Then on the 25th, as a result of the Association of Minnesota Counties meeting, they strongly encourage us attending the cybersecurity meeting that was held, a workshop that was held in St. Cloud on the 25th. Honestly, I have to admit that I wasn't planning on attending it. I signed up like the day before or the day of, and it was really geared towards IT specialists and emergency operators and staff and administrators and commissioners. And it was kind of sobering in that they basically said it's just a matter of time before all of us are going to be hit with some sort of cybersecurity in our systems. There's one county in the state of Minnesota that's paying a lot of money right now for having done that. So one of the presenters was an investigator who spent most of his career with NASA in IT, and the other was a nationally recognized attorney. And there's a program, and I'm not going to be able to tell you what CISA stands for, it's CISA assessment, but all counties could get a free assessment on your security. It's kind of a checkpoint. It's not an audit. They made it clear. Audit would tell you that what you have to spend after they tell you what's wrong with it. The assessment will tell you where you could use improvements, but not how you need to spend the money. I actually shared a product that came out of that meeting when I had the tour the other day with Dr. King, and asked him to share it with Scott downstairs and anybody else who wants to take a look at it. So something to pay attention to. And that is it, other than the EDC Broadband Committee, which Commissioner Anderson already talked about. So anything else to come before the board? Did you have some? Okay.
I have one thing. I won't be able to attend the Veteran Advisory Board meeting on May 14th at 1 o'clock, and I guess I looked up, there isn't an alternate.
There
so-
is not an alternate?
Yeah, so if anybody, yeah, it didn't say on the thing, so on the sheet. So anyway, so if anybody can attend,
Looking.
that would be great, so that we have somebody representing.
What time of the day is that?
1 o'clock on the 14th.
Steve, you and I have,
Yeah, we have CHB.
yeah,
So
it's up to you two guys.
I could do it unless you wanted to.
Dale will be planting beans if he get the
Yeah,
field.
if it gets nice.
All right, I'll
ahead.
forward that to you then, Court.
Okay, all right, 10 o'clock
you.
on the
All right.
14th, right?
Thank you.
Here.
If there's nothing
Yep,
else,
no, multi-purpose room.
sorry. If there's nothing else to come in front of the board, I will adjourn the Kansas County Board of Commissioners meeting.